Today we'll be discussing some frequently asked questions in regards to facial paralysis. One of the most common questions we get is, what is the most common cause of facial paralysis and what are the side effects? The most common cause of facial paralysis is Bell's palsy. This affects 20 to 30 in 100,000 people. It is due to reactivation of the herpes simplex 1 virus, which as young adults and children, many people are exposed to, causing mouth sores. The virus doesn't go away, but actually ends up living in the nerve that is in close association with the tongue and then travels back to join the facial nerve in the mastoid or behind the ear. Due to inflammation that the reactivation of the virus causes, the facial nerve can then be affected. And this typically presents with pain or discomfort behind the ear in the mastoid bone where the facial nerve is inflamed. The facial nerve expands through this inflammation, but because it's surrounded by bone, it ends up experiencing what some of us think of as a crush injury. That ultimately causes the side effects of the Bell's palsy, which include complete facial paralysis, burning or pain behind the ear, sensitivity to sound, and a metallic taste in the mouth. Now we'll focus on the facial paralysis, as this is the symptom or the presentation that most likely brings patients to the office. And what happens is patients will notice that they have difficulty lifting their brow, closing their eye, or blinking. They may have some nasal obstruction on the affected side, and they cannot move the corner of their mouth on that side, so they're unable to smile. They have difficulty eating, drinking, and expressing emotion. In addition to those functional side effects, patients often complain of psychosocial issues as well and behavioral issues. Many patients do not want to go in public, many patients feel depressed, and they have a difficult time expressing the emotion. The treatment for acute paralysis, secondary to Bell's palsy, is high-dose steroids and antiviral medications, and in some cases pain medication as well, if patients experience pain in their face or in their ear. And this usually should be initiated within the first 72 hours after diagnosis. Now, when you experience acute facial paralysis, you should see a medical professional to be ruled out for more serious causes such as stroke and other issues. Now, what other issues can lead to acute facial paralysis? In addition to Bell's palsy, there's another virus called Ramsay-Hunt, which is a reactivation of the varicella zoster virus, also known as chickenpox. There's also Lyme disease is a common cause, and patients who have severe ear infections or complications from otitis media can also develop facial paralysis. Less common causes include fractures of the temporal bone or injury to the facial nerve, and these can be experienced through blunt trauma with a high-speed motor vehicle accident, or from a fall. If you're not wearing a helmet and your head hits the ground, you may fracture your temporal bone, which is where the facial nerve is located. And then also trauma with a stab injury to the face can injure the facial nerve as well. And last but not least, tumors along the facial nerve or in the skull base may also be associated with acute facial paralysis. But Bell's palsy is the most common. Now, how long does Bell's palsy take to recover? Usually it takes several weeks to a few months to recover. Ramsay-Hunt will recover as well, however it takes longer time. And the other causes, it typically depends on the severity of the illness or the disease and what other treatments are required.